So we're pleased to announce one of the first new technologies to enter the world of hair transplant surgery or hair restoration surgery. It's a product called ACell, which is an extracellular matrix. It's essentially a growth factor. It comes in two forms. One is a sheet-like device, and the other is essentially a powder. And again, it's really the first exciting new change in hair restoration in probably the last 10 to 20 years. It was first discovered in the use of revising old scars. One surgeon in particular, when using it in these scars, noticed that not only were the scars much improved, but there were actually new hairs appearing in that same scar line, which we'd never seen before with scar revisions. So the next sort of leap of faith was to start using this in areas with thinning hairs to try to increase the density of hairs from both transplant surgery as well as even in patients who weren't necessarily having a transplant, but rather in situations where we were injecting the material with a vehicle of platelet-rich plasma. That combination so far has shown very promising results. We've had patients go through one of two ways of using ACell. The first is using the injectable form, which again is in this PRP fluid, and that is simply injections, no incisions, no other major surgical steps are required. With that, we're seeing as soon as 4 months new hair growth in areas where there are thinning hairs. This cannot be used in an area where there's an absence of hair altogether, but it's showing really promising results in those types of situations. And again, the other scenario where we're using this is with the hair transplant process. Essentially what we've been doing is dipping the grafts into this powder, and it serves as essentially a fertilizer, increasing the yield of each graft. The quantitative results are still not yet finalized, but the initial data all suggest improvements with either use of the ACell. So again, it's really exciting for us because we've not had anything that's changed the face of hair transplant surgery so significantly in the last 10 or 15 years. Again, as more quantitative data is available to us, we'll know for sure exactly what increased yield we are able to achieve. But we're so encouraged by the initial results that we're now using this essentially in all of our hair transplant patients.